You're welcome to Reproductive Health segment with Dr. AJAYI. And my name is Dr. ABAYOMI AJAYI. We know that we've defined infertility in many ways. Emotional roller coaster, going through the maze, But one thing that is important that we need to know is that it's a phase that will go. But it's so important for us to know how to cope. So today we're talking about how you can cope while you're waiting. And to do that today is ESTHER ODIETE. She's a fertility counselor. I'm sure many of you who are conversant with this program will have seen her so many times on the program. ESTHER, you're welcome.
Thank you, sir.
So, you're talking about how to cope while we're waiting. So please tell us more about this.
Okay, for marriages to survive infertility crisis, the couples, they must learn how to continue to tend the garden. Let me use the word, tend the garden, and the garden of marriage, and they have to make deposits, positive deposits, for them to be able to cope during this crisis process. And it's a special effort that they need to make, special and conscious, and it requires positive energy. Mark my words, I'm using the words positive energy for them to be able to cope during this crisis period. And I'm going to talk about some steps that will be able to help them to cope during this process. And the first one is to work as a team. Despite the fact that we have different factors of infertility. It could be maybe the male factor, the female, or combined factor. If it is just the female factor, the spouse shouldn't see it as the woman's problem. Or the other way too, if it is the male factor, the woman shouldn't see it as the husband's problem. They should work together as a team, and that will help them to go through this process, to be able to cope. If they are proceeding for the treatment or they are not going immediately, it will help them to be able to cope if they see themselves as this is our challenge and not just one person's challenge. And that's one process. Then another...
No, sorry, before you go on. In this environment, to highlight what you just said, we know that men, traditionally, it's changing, I know, don't see infertility as their problem.
Yeah.
And that's the woman's problem. But you know something, I've also seen women who also use the same thing against their men. Say, you want to say you are a man, Abi. Any small argument, that's what it results to. So what you're saying is that such people are not likely to overcome this challenge. And that's what leads to a lot of breakdown in marriages. Yes. Wonderful. So, okay.
So if they see themselves as we are in it together, it will help them to cope. Then another thing again is for them to plan a playtime. Because this challenge brings anxiety, a lot, they are tensed and all that, and they don't see themselves together playing. It's just infertility. So they can just decide to take time off, relax, forget about this infertility thing, and enjoy themselves together. They can just also go out for dates. They can fix a day within the week. Like some couples, what they do, it could be on maybe Wednesdays, every Wednesdays, or Fridays, or weekends. It's just the two of us. Let's just go out and enjoy ourselves. And they take infertility out of the whole process. Also, they can go out for vacation. It will also help them. Just create time to be together. You're not talking about infertility, but just other things that you know will make you happy. That's one process. Then, to add to that again, is that they should separate baby making from love making. It's a big challenge when couples that are faced with this infertility issue. What they usually do most of the time is just search for the ovulation period. Even men these days, they are aware of it, how to calculate and all that. They help the woman to calculate. So they just focus their mind on just that period in the month, and that's when they have sexual intercourse. You know, the focus now is just, we just want to make babies. They are taking the fact away that sexual intercourse is not just for babies. It creates a kind of bond between the two people. And by the time they take that off their mind, that it's not just for babies, just to make babies, but for us to still be together in this, it will also help them. And in order for them to be able to do that, it's...
Sorry, some of these things, is there any way that they can be helped to get to this point? Because, you know, most of the patients we see, if they've been married for about 10 years, okay, 15 years, and there is no baby, the natural reaction is, come on, why am I still doing this? You know? Are there things that can help them to overcome all this so that they understand? Because it's something for you to know. It's another thing for you to be able to do.
Right, sir. Okay, ways in which, like some clients that I've seen with issues like this, they can try to make a change in their lifestyle. Maybe the bedroom that they use often for making babies, trying to make babies, they can change that room.
Okay.
It will make a whole lot of difference. They can change that room. So it won't just be as if we are going to same place to just do same thing all over. Another thing again that will help them is just for them to recall how they started. How they started. That excitement that was there at the initial stage, there in this challenge of infertility hasn't come into play at all. If they can recall all that, it will like add a zest to the whole process, and it will not just be we are just going in again for same thing, but something different this time around.
Wonderful. I think, Esther, you know what? I think we have to stop at this point for this week. We definitely have to continue next week. I thought we were just going to take it for 1 week, but obviously we can't do it in 1 week. So, viewers, I hope you're enjoying or you're learning from this discussion about how to wait or how to cope while waiting. So it's on this point that we'll see you next week when we continue this discussion. See you then. Bye.